stories that we are highlighting for you, and also issues that you want highlighted in this broadcast in future. We cross over to the other side.
Right, in time for our last conversation this Tuesday morning, we want to talk about general surgeries performed on patients. So what exactly do we mean when we talk about general surgeries, and especially during this COVID-19 time? For those patients that might have scheduled surgeries or even just any checkup on, in the hospital, how then do they go about this? Is it a time when people can fear? What can be done at least to remove that fear? Joining me on set this morning is Dr. Bryan Mulando, Head Medics Bliss Healthcare Limited, who will be helping us understand more about this. Dr. Good morning.
Good morning. How are you?
I'm fine. How are you doing?
Good.
All right. Now, before we get deeper into, even the COVID-19 aspect, first of all, when you talk about general surgeries, what that brings in mind is that there could be other forms of surgeries. So just for the benefit of our viewers, when you say general surgeries, what exactly do we mean, and what comprises of this kind of surgeries?
General surgery basically means any other surgery that is not a specialized surgery. Okay. These are surgeries to do with the abdomen, surgeries to do with the rest of the body, besides heart surgeries, which are more specialized, brain surgeries, which are more specialized, spinal surgeries, which are more specialized. Basically, all the other surgeries are general surgeries. When you speak about general surgery, usually we divide them into two.
Okay.
Yeah? They're what we call minor surgeries and major surgeries.
So these fall under general?
Yes, they fall under general.
Okay.
All other surgeries that are specialized are also major surgeries. Okay. There can be minor surgeries like to do with the skin, to do with the muscles. Okay. Those are minor surgeries. They are called minor because they don't necessarily, you don't have to make someone sleep completely. So the only difference between minor and major is where you have to make someone sleep completely or partially. We have seen in females when you want to operate, maybe to remove, to do a cesarean section, to deliver by surgery. So we inject at the back. So that is also considered a major surgery because it's
considered a major one, but still falls under the general category.
But for cesarean is a little specialized because it's a maternity surgery done by obstetricians. So that is more of a specialized surgery, but can also be done by other doctors. Precisely to say medical doctors, medical officers can also conduct that surgery. They are licensed to conduct that kind of surgery. So in brief, in summary, that is general surgery. Any other surgery that does not involve specialized organs. Yes.
Any other surgery that doesn't involve specialized organs falls under the general category of surgeries.
Yes.
Now, in your line of duty as a doctor, probably even as a surgeon, what would you say is the most common kind of surgery that even you've performed in your line of duty, and what makes it common?
One of the commonest surgeries is there are things we see on human beings, small swellings, yeah, that are done, especially if you go up country. Let's not look at Nairobi alone, because Nairobi has more specialized surgeries, but let's look at the broader country, up country.
Yes.
If you go to Marsabit, if you go to Kakuma, if you go to Nyeri, there are those surgeries that are easily performed by the medical officers. Okay. These are surgeries to do like lymphomas. These are swellings that happen on the skin, below the skin. They are non-carcinogenic tumors. They are benign tumors. These are non-carcinogenic. They are not spreading in nature, but they grow in one area. So those surgeries are very common and they can be worked on. Other surgeries that require...
And they don't really need that specialized
They don't require the specialized surgery, and they just require some putting some anesthetic agents around the area where you're going to operate.
Right.
Okay? So you don't need to make someone sleep. It's that simple. Just require minor theater or a side procedure room and then conduct it safely. The other commonest is appendicitis. So appendicitis, there's a part of the intestines we call an appendix.
Yes.
Okay? So very commonly that part gets infected. And when it is infected, it therefore has to be removed because it has no major role in the body, in the digestive system. So that is the other commonest one, and it is a simple procedure that will take you probably 1 hour, 1 to 1.5 hours, and it is done. Although it is majorly done under general anesthesia, where you make someone sleep completely. Yes.
Now, before we look at probably other types of common surgeries, what makes that part to be infected that you just mentioned?
You know, if you look at its location
Yes.
in the the body, in the large gut.
Okay.
It's a small, it's almost like a finger, small finger like this. Yeah. So as the food moves through, so anything like a stone, anything like a mass, a stone. If you eat rice, you know, rice has a lot of stones. People who eat a lot of rice tend to get this problem. So these stones tend to drop into that. So once they accumulate, they block the whole lumen, and then fluid starts accumulating, and then infection sets in. So you start having symptoms of pain in the abdomen. So when we examine you, then diagnose and do an ultrasound, we find is that, then we have to just cut it out.
Then does that mean that you have to avoid rice or just take it in limited portions?
No. Actually, when you're taking rice, it's good to buy clean rice.
Okay,
That's
so that
one.
is the whole idea,
Yes.
not doing completely away with it.
Yes, this rice that people go and put on the ground, and then they just pick up country,
Should be
basically
very
in the
cautious
villages.
about
Yeah,
it.
they just collect and then go and cook. You have to sort it very well to remove all the small stones.
Okay.
Yeah, or buy rice that is already packed and well sorted. Yeah, that can help minimize this problem.
Okay, so the idea is to get clean kind of food, at least to avoid some of
Yes.
these complications that may lead
Exactly.
someone to this kind of surgeries.
Sure.
Now, there's another thing I want us to talk about. This is in regards to circumcision, because it's also a part of surgery. And yesterday on the papers, we had the story of the Bukusu culture that is in western part, where they still perform the traditional kind of circumcision. As a doctor, what would you say about this? What is your take? Is it advisable? Is it right, given that we have modernized ways which might be safer?
You know, there's always a debate between culture and modern day medicine.
Okay.
And this debate, when you go to these villages where these kind of practices are happening, they keep saying, you know, for you to become a man, you must go through this kind of circumcision. But times have changed. In some areas that practice circumcision, like the central region, they are doing it safely in hospitals. Okay? They go through
So
churches.
still doing it, but in a safe way.
Safe way. Okay?
Yes.
The danger with what is being done on the other side is they are sharing, you know. When you share the instruments that you're using from one person to another, there's a risk of transmission of diseases. Common one is HIV, which we all know about. So we have, as health practitioners, as counties also I know, they have continuously spoken out clearly against this kind of practice, and we keep encouraging parents to bring their children to hospitals to be circumcised. Circumcision is also a general surgery procedure.
Also falls under the general category of
Yes,
surgery.
general surgery, but does not also involve making someone sleep. So we just inject the drugs around where you're going to operate, and then you do the operation. But it's more safer. We have seen other cultures shift to medical safe practice of circumcision. Yeah, and I think this is where we need to go, and we shall keep continuing to encourage people in that region.
Okay.
And
People in
all of
that-
us are working towards that to ensure that they adopt the new way of safe circumcision.
Safe circumcision. So you're going to keep continuing to encourage people in that region. So again, from your perspective as a doctor, would you say that the major problem then is that it's just that aspect of culture that is making especially persons from that area not to embrace? Because what you're mentioning is also the health risks that come with this kind of circumcision, yet we know there's a right and a proper way of performing this surgery.
You know, it's people who just lack some knowledge, you know. It's a culture change. Okay.
So it also boils down to knowledge.
Exactly.
Okay.
You know, culture is so deeply rooted amongst Africans.
Yes.
Okay. It's just like telling someone, write with this hand, yeah, or make your signature with this hand, and then they tell you now sign with this one. Yeah.
Very difficult.
It will be very difficult.
Yeah.
So anytime you need to achieve change, it's painful, it's slow, but sure. Okay. Great strides have been reached in terms of safe circumcision. Okay, like I've said, in the central region, I have seen circumcision is happening safely in hospitals. They no longer do the cultural circumcision where they're sharing the same instruments to work to circumcise every other boy. You know, it took time. So through continuous education to the elders, through laws also, policy. If the government comes out and probably abolishes or comes up with a policy that will be against this kind of traditional circumcision and ensures that if you are going to practice it, it is outlawed, then this kind of practice will end. But as medics in the healthcare industry, we shall continuously speak positive about circumcision in hospitals, yeah, as we discourage the traditional way of circumcision.
Yeah.
Yes.
You know, and I mean, that's fair enough because, again, just the way you're mentioning that the health risks, yet there could be a good and an alternative way of doing it, which is, again, more healthy and also more beneficial to these persons. Now, let's talk about something else, the emergency and the urgent kind of surgeries. When you talk about that, what exactly do we mean, and what comprises of the urgent ones and the emergency kind of surgeries?
You know, by definition, an emergency is something that cannot wait. Okay? It's a life-threatening...
It's a matter of there and then.
Yes, it's a life-threatening condition.
Yes.
Okay? By definition, in a simple way, it's a life-threatening condition that requires urgent, immediate intervention. I'll give an example.
Yes.
If someone collapses, for example, okay, they have been standing, and all of a sudden they collapse.
Yeah.
And there are many causes that might make someone collapse. One of it might be low blood sugar, yeah, or high blood sugar, for example. So this kind of emergencies could be bad if it happens in a place where you have no medical personnel around to try and intervene. Okay, and that's why people die, even of simple things like low blood sugar, which can simply be managed by injecting someone with some few mils of glucose, okay, so the person can get up. That is an emergency.
Yes.
If your blood sugar goes below 2, below 3, yeah, and you collapse, it is an emergency.
That makes that case an emergency case.
Yes.
Okay.
Now, an urgency means there is an impending danger to your health.
Okay.
Okay?
Yes.
That is an urgency. And I'll give you an example. You know, when your blood pressures, let me use another example, which is common. When your blood pressure...
Something at least viewers can be able to understand.
Viewers
what
can
exactly
able to understand, yes. When your pressure goes high,
yes,
okay, there is a limit beyond which, if it reaches there, will tell you you are at risk of getting a stroke. Okay? A stroke could be a bleed in your head. So if your blood pressure goes beyond 170, you know, you are at risk of developing a stroke by a bleed because of high blood pressure. So it is an impending, it's the situation where there's an impending danger. If nothing is done to bring it or to reverse it, then you'll go into an emergency.
Into an emergency.
Yes.
Now, you talked about the pressure issue, which just brings me to my next question. Again, that just for the benefit of our viewers, because oftentimes you'll hear someone saying, I'm having a lot of stress, just bringing my pressure up. So what exactly causes someone to have this pressure, and how can someone avoid them so that they don't get into that point where they'll have to go, you know, on under surgery or something of the sort just to help, you know, cure that? What brings about the pressure, and how can people avoid that?
You know, pressure is something that does not just come suddenly. Okay, there are many contributing factors.
Okay.
And pressure simply means the heart is pumping at a faster rate against a resistance. For example,
yes,
let me put it in a simpler format. The blood vessels are lumens, or they are pipes that transmit blood. Okay, over time, these blood vessels, as we eat a lot of fat, a lot of chips, a lot of these things people love eating, they accumulate in these pipes that transport blood.
Again, we go back to the aspect of food.
Yes.
Okay.
So when the pipes get corroded, just like when you have a metallic pipe that is transporting water, over time it will rust inside.
Exactly.
Okay.
Yes.
And the pipe, the lumen of the pipe will become small. So because the lumen has become small, okay, the heart has to use a lot of force to push blood through this small pipe, which was bigger. Now it has become small because there are a lot of cholesterol and all these things that are in that lumen. So that causes pressure. So that pumping force of the heart is what we call pressure. Okay? And that's how pressure comes about. So when someone is maybe stressed, okay, there are stress hormones. Now these stress hormones will indirectly impact on the heart. They will tell the heart there is an immense danger, you have to pump. So the heart will start pumping at a fast rate, giving you that kind of unnecessary pressure. But it's usually controlled once the person is in a calm situation. Usually we don't have to manage it with drugs.
Okay.
Yeah? Yes.
So at least also
as long as we know it is not pressure that has, as long as we know it is pressure that has stemmed out of stress, then we need to manage the stress, the cause, rather than giving drugs.
Okay. I think that was very important to be clarified because, you know, just also stress can also be a contributor and also better ways for people to learn how to manage that. Now, keeping up with the urgent kind of emergencies, I also was reading an article which was saying that trauma is also one of the urgent kind of, you know, surgeries. So I just want us to understand, when you talk of trauma, what exactly makes it so urgent and what is the leading cause of that? Because again, also just like pressure, you'd hear some people saying, because of A, B, and C, and D, I feel like I'm traumatized. I just can't handle. I feel like things are just happening a lot, so I feel I'm traumatized. So I want you to explain to us what exactly does, you know, bring about that, and what makes it an urgent cause, an urgent kind of surgery.
You know, trauma is an English word. Yeah, like you hear people speak. You know, I'm traumatized.
Okay.
Okay, it's an English word, but in the medical circles, trauma is something else.
It's something entirely different.
Slightly different from what you know, in English, usual English terms, it's more of a feeling, yeah, based on the same example you have given. I'm traumatized. It's more of a feeling which you can't touch, which you can't see. Okay, in medical circles, trauma is a condition. Okay, I'll call it a condition that comes, for example, if you have an accident. Okay, you have had an accident, a road traffic accident, and you are a trauma patient. So the reason why it is an urgence, it falls in between. Okay, there's a thin line between an urgence, and emergence when you're a trauma patient. Okay. And I'll try and explain the two.
Yeah.
So when we say it is an emergence, this is someone whose life is threatened completely, that if you don't intervene immediately, you'll lose this person. Okay? For example,
that is what makes it urgent?
That is an emergency
case.
Emergency case. Okay? Yes. That if you don't intervene immediately,
something will happen.
This person will pass away. Not just something will happen, he will pass away.
Die.
Okay? He will actually die if you don't intervene. Okay. This is a person who might have a bleeding in the brain.
Wow.
Okay?
So it's that really serious?
Yes, because of the knock of the vehicle. Yeah, he may get a fracture on the skull and is bleeding in the brain. So you urgently have to go into theater and open up and close the bleed. Okay? Yeah. That person will pass away if no intervention is done. Now, an urgence is where the person who has had an accident, okay, is walking, okay, but not stable. That is a person you want to examine and do some investigations to see, to check on all his systems, organ systems, to see if they're okay. Okay?
Okay.
Is an urgent person, but if not attended to, will go into another emergency situation.
Right.
Yeah, we'll proceed into an emergency situation. So that is an urgent person, is stable, but requires to be attended to and examined properly.
Properly.
Yeah, to exclude any damage, internal damage. Yes, so that is an urgent person. Okay.
And the other one is an emergency.
The other one is an emergency who has already shown a complication by examination. You see, this is the most likely complication, is bleeding in the brain. We urgently need to go to theater, open up, close the bleed. Yes.
Well, okay, now I think now it really now makes sense, at least to understand when you talk about urgency cases, what exactly do we mean when you talk about emergency cases?
Exactly.
What it means. I think you've really well expounded on that. Now let's look at the painful kind of surgery, because again, from me, just from that layman's perspective, you'd expect and you'd think, if it's a surgery, it has to be painful, especially afterwards, you know, while you're trying to nurse the wound. But I want to understand that there are painful kind of surgery and there are those that are quite less painful. What brings about that? Or is that even true?
Thank you, Doreen. Let me just give a brief. When surgery started, so many years, an individual used to be tied on a table. Yeah, no anesthesia was happening.
Nothing at all?
Nothing at all, and they would hold you and the doctor would cut. And the person who did the first surgery was not even a doctor.
Wow.
But as we have gone...
That looks intense.
Really, yeah. As we have moved over time, surgery has evolved, you know. Nowadays, you cannot operate on a patient when they're feeling pain. Part of the management of anesthesia is pain management, okay? And the whole team that is involved in the operation of this patient has to ensure the patient is not in pain. First, they have to speak to the patient, okay, before the surgery. explain everything, detail the ins and outs of this surgery, okay, and the risk factors, okay. This the patient must know, and the whole team has to go and review the patient 2 to 3 days before, the surgery, before the D-day for the surgery, so the patient is comfortable.
The team has to go and review that.
Yes, they have to review on a daily basis, okay, to ensure they prepare the patient. Of importance also, you need to prepare the relatives, okay. Because sometimes we tend to focus on the patient and we forget the relative.
The family and the relatives.
The family is very important because they are also patients. Much as they are not sick, they are actually they are more sick than the patient.
Than the patient himself.
So if you don't manage the patient, the relatives, then sometimes you'll have challenges because they'll continue speaking to the patient, the actual patient, in a certain way. So you need to manage them, encourage them so that they don't keep scaring the patient. That is one. So when you go in the theater now in the theater, the patient has to be made to sleep if it is a general operation, okay? That patient should not feel pain. Patient should continue breathing. Patient should not listen to anything.
You should make sure actually he or she is okay and well.
Exactly.
Okay.
So basically we do our best to ensure that the patient does not feel any pain at all. And then post-surgery, after the surgery, pain management is very key. And it starts right from theater to the recovery area. There's an area after the theater. There's a point where they put you for recovery, to monitor you, to monitor your oxygen levels, to monitor if you're breathing well, if you're able to breathe on your own, to monitor pain response, to see whether the patient is basically fine, to monitor the vitals. Is your pressure okay? Is your temperature fine? Okay? Are you bleeding from the incision site where you have been cut? Are you bleeding? Everything is normal, All these things have to be looked at before you're transferred back to the ward. So the whole process, pain must be controlled. Yes.
Pain must be controlled.
As much as possible.
As much as, okay, fine. And now with what you're explaining, is that the entire process that goes in before a patient goes into surgery, or there's something extra? Because also there's that aspect of probably encouraging the patient, talking to him or her, maybe ensuring them that things are just going to be fine. Because sometimes one may be really anxious, you're scared and you're wondering, will I really come out of this thing alive? What will happen after me? Stuff such as that one.
There's what we call informed consent. Okay?
Yeah.
In hospital. An informed consent simply means the doctor must give all information in fullness to the patient. The advantages and the few disadvantages, if any.
If you're choosing to go through the process.
Exactly.
Okay.
And at the end of that process, the patient has to consent that, yes, the doctor has explained to me everything. I have understood, and I agree to the procedure that is going to be done. And I'm liable for anything that may happen. I agree. Okay? That the patient has to sign if the patient is in his normal senses. If the patient is not is a minor, for example, below 18 years, according to our law, that patient cannot consent. Then the guardian has to consent. Okay? Also, there's a scenario where you can have a patient is incapacitated mentally. So the guardian also has to sign for that patient.
That means they're not in the right state of mind at all.
Exactly. So that one also, the guardian has to sign on their behalf. But full detail of whatever that will entail in this procedure has to be given. Okay? And like I said, you have to have 3 days prior, every day, having a chat with the relatives.
This is before the actual day.
Before the actual day.
So actually there's an entire process that goes into this.
And the entire team that will be involved in this procedure has to keep checking on this patient, keep discussing. The anesthesiologist or anesthetist, the nurse, the chief nurse, the doctor who will conduct the surgery himself. This whole team, whoever has to be involved, they have to go and review this patient on a daily basis, have a discussion with the relatives or the guardians, so that all of you are on the same page, on a day-to-day basis, what process is going to happen, and after what will happen, how long will the procedure take. It may go beyond the assumed time, but at least they should have a clue so that they're not anxious why their patient has taken a whole day in theater because it is a heart surgery, and probably they thought maybe it will take 1 hour.
And they're wondering, why is it taking the entire day?
That is when you'll walk around the theater area and you'll find people saying, has our patient passed on and these people are not telling us. Okay. All this has to be discussed with the guardians.
Okay. Now, Dr. there's sometimes, I want to imagine that probably a scenario where someone, you've walked through the process with this person, you've explained to them, even probably agreed and even signed the consent. Probably, and I want to imagine that in that kind of scenario, they are now mentally prepared to go under the procedure. But just like I mentioned before, there's that case of anxiety, probably you're scared. Have you been in a situation as a doctor where someone has gone through the process, agreed, but then it gets to a point where they say, no, I'm not doing this anymore, and they really have to, go through the surgery?
That's why I said initially that it's a process, okay? That can happen, and it happens sometimes.
So it can happen?
Yes, it happens.
It's a probable case.
But if you look into those cases, you find probably the medical team focused on the patient, and they did not focus on the relatives or the guardian. Remember,
so
I told you.
It is very important.
Yes, remember I told you. Yes, I told you if you don't manage the relatives, they're actually more sick than the patient. Okay. If you don't manage them well and explain to them, because patients have a tendency of listening to other people around them, who are non-medics, and they'll take their word sometimes as gospel truth. I don't know why, but it happens. So that is why, as medics, as healthcare, we need to manage the relatives. If you manage the relatives well, you manage the patient well, the relatives will keep encouraging the patient. And yours will be supplementary.
And so yours just come to finish the work. If you do the procedure, just come and do the procedure.
Because these are the people around this patient every day,
they know
every
the
minute.
Patient better.
Exactly. Okay. So if they encourage, if the patient sees that, everyone is standing with me, everyone tells me I'll do it.
Everyone is for it's important because
it's
of
important,
this and that.
yes. She'll be relaxed.
Okay.
Yeah? Yes.
So again, really just, reiterating that it is very important, not just to focus on the patient alone, but also the family and the relatives, as they play a vital role.
Exactly.
All right. Now, just to remind our viewers, I'm speaking to Dr. Bryan, talking to us about general surgeries, what exactly it means when you say general surgeries, what kind of surgeries comprise of this general kind of surgeries, and how to proper manage them. And also later on, we'll touch on the issue of COVID-19 and patients going to hospital. Now, Dr. before we get to that aspect of COVID, again, you had mentioned earlier on about the risk factors. So that just makes me to want to know, are there risky kind of surgeries? That you say, this one is, even for me as a medic, this is actually risky.
Every surgery is risky.
Every surgery is risky?
Yeah, every surgery has a risk, and that's why I said the doctor has to explain to the patient the advantages and the disadvantages or the risks involved, okay? Even a small surgery like circumcision can kill, okay?
So we can think it is small, but it's not quite as how we want to imagine.
Sometimes if, let's use circumcision because it's very common.
Yes.
Sometimes the drugs we use, if someone is overdosed, okay, though these risk factors can be prevented, many times they can be prevented, but sometimes it just happens, okay? Maybe it's out of some laxity of one of the team members, anything can go wrong, but the team should be able to attend to any emergency that will arise out of this procedure, okay? So if you go to any theater, they always have a whole emergency team nearby on standby in case of anything. Anything can go wrong. Sometimes I've seen doctors who are conducting a heart surgery, and somehow the heart is stopping. So an emergency team has to come in. Of course, in the middle, or you are doing an abdominal surgery and the patient starts getting a cardiac arrest. So the emergency team has to come in. As you, the surgeon, general surgeon, you're trying to close up the abdomen, then the other team has to come in and start working on the heart, to ensure that the patient is able to wake up. It happens. So all these are risk factors that have to be explained to the patient, okay? But of importance, you must ensure that you have an emergency team. You're ready to handle any emergency that can rise, can arise out of any surgery. If you are not sure that you are able to attend to any emergency, then don't start the surgery.
Don't start. Don't try and show that you're a surgeon, you went to school for this.
Yes, it is safe not to start up until you are able to attend to any emergency that may come up. And
I think that is very important, just making us understand that this thing is not always a one-man show, that even after you've talked to the patient, talked to the family and relatives, just for you as a doctor, as a surgeon, it's not just you as a person. Actually, there's an entire team that backs you as a doctor. So I think that's really important to just make us understand. Now let's talk about foods. what kind of foods does a patient need not eat when they're about to go for a procedure? Because sometimes you'll say, you know me, I can take anything. I can drink water, I can take tea, or I'm used to a certain habit, taking alcohol, smoking, so it's just fine. It's just a surgery anyway. So what does a patient need not take when they're about to go under a procedure?
You know, there's a general rule we use, and I'll tell you why.
Yeah.
There's a general rule we say, because you can't stop a patient from eating. Yeah. And you can't tell a patient, you know, I want you to eat meat. Yeah, I want you to eat chicken only, you know. The patient should be able to eat what they can afford. Okay. Some people can only afford greens. Some people can only afford cereals, you know. Some people can afford the meat. Some people can afford the chicken. Others can afford the fish. Whatever the patient can afford, they are able to eat, unless it is contraindicated in their condition. But let me come to because what we usually tell people is, do not eat 24 hours or 12 hours before the surgery.
Wow, there's a time frame there.
Yes, there's a time frame we usually give. Only take fluids, okay? Water, maybe milk, okay? Even the milk, we tell you stop probably at night, at midnight.
So you can take water?
You can take water up to some extent, not even up to, maybe up to midnight you can take water. We can advise that way. But at least 12 hours before the surgery, you should not eat solid foods. And the reason is simple. You know, when we make you sleep so that surgery can happen, part of the things we have taken over from you is your ability to control your body. Okay?
Oh, yeah.
Including swallowing.
Yes.
Okay?
Yeah.
So because we have taken away that ability, natural ability from you, so we have to control it artificially. Okay? We have to put a tube. So if you have food in your stomach,
you've been eating and eating,
you have been
the entire night.
eating and eating, there's a risk of it coming back. Okay? And then it will go into your airway. Yeah? So that is what we try to avoid. So that alone can cause complications in the procedure.
In the process.
In the process of surgery, because if you are going to have fluid, uji, coming away from your stomach into the airway, then it will go into the lungs where it's not supposed.
So you wonder which one do you do? Do you start managing this one, or you continue the procedure itself?
So it's a risk management process that we take the patient through. Do not eat 12 hours before. If you are to take water or chai, take only up to this time. Don't take anything beyond this hour, up to until we complete the procedure. And we keep feeding you with food through the veins. So there's that ability. So the nurses on the ward will, of course, the doctor will come and advise, stop the food, but put the patient on glucose, on some food through their veins so that they don't get weak. Okay, yes.
And I think you've really done well to at least clarify that bit of water, because again, also I was looking at another article that was saying also for water you can't take, and for me I was wondering, you know, what is wrong with water? But I think it's also important that you said it's only until a specified time, and also important for you to tell us that it's because of the risks that you're trying to avoid and other complications that might come about while the procedure is happening. And also for the foods, you say that a person can take any kind of food that they are comfortable with and the ones that they can afford.
They can afford.
So that means there's no restriction that you have to take beans, or you have to take meat, or you have to take milk.
Exactly. Unless specifically advised by the doctor. There could be conditions that the doctor will advise. Take only this for this number of months. Don't.
Which conditions are those, Doctor?
You know, there are people who could be having some abdominal issues, for example, and the doctor will advise you, do not take legumes. Legumes are like beans. Okay, those kind of cereals, because they'll cause a certain kind of feeling, which is not good, that the doctor is trying to manage. Okay.
Yes.
So there are many conditions, and different conditions may call for certain foods. Okay. For example, people with kidney conditions, you might tell them, you know, reduce on the intake of protein. Or
in that moment when you're about to go to the procedure.
Yes.
All right.
Because we need to control certain parameters. Okay. So different diseases may call for different diet, and that is where the nutritionist is very key. In advising the patient. Because you need to advise the patient. So again,
also there's that aspect of nutritionist.
Yes. So it's a holistic care. Holistic care involving so many different professionals. Because sometimes you want a nutritionist to explain to this patient and say, ask the patient, what can you afford? Okay? So if you ask a patient, what can you afford? So the patient will tell you, this is what I can afford, this is what I can afford.
Yeah.
Then the nutritionist
Yeah.
has to ensure that from that list the patient has given, she can actually ensure that there's a balanced diet, okay,
Yes.
from the different things that the patient can afford to buy, okay, not necessarily going for certain foods that are expensive. Yeah.
Well, I think this looks more like a learning curve. You know, it's just interesting to know that it's just, you just don't wake up, or you're not scheduled for a surgery and then you go for it.
Exactly.
Actually, there's a whole team, even a nutritionist, to advise you what exactly you need to eat, what you need
Sure.
to avoid, also based on your condition. If you have prevailing conditions, what you need to avoid, what you need to eat. Now, let's talk about immunity, because even given the kind of time we are in, the COVID-19 pandemic time, most of what you are hearing right now is at least get and try as much as you can to eat foods that can boost your immunity, you know, because we don't have a cure yet, we don't have a vaccine. So what you're trying to do is get our immunity up to par. Now, for someone who's probably scheduled for a surgery or even slated to go for one, is there a specific food, a specific kind of foods they need to eat to boost their immunity before they go for the procedure? And if so, what is the importance of that?
You know, true. Thank you so much, Doreen, for that question. This is a very important question, because COVID is around our country, and
Yes.
we cannot run away from it.
Exactly.
We have to speak about it, because everyone wants to understand what is this disease about, how do we manage, how do we prevent it.
Yes.
So COVID, like you have rightly said, there's no known treatment as of now. There are only drugs that can help manage the different symptoms that come about with COVID, when you get infected with COVID. But of importance is that we all know one's immunity is built by what they eat. Okay?
It's all what you take in.
It's what you take in. Okay? That is what builds your immunity. So we have to take a lot of vitamin-containing foods, a lot of fruits. Okay? These are mangoes, watermelons, name them, there are many. Okay? Oranges, all these things.
The
Vitamin
fruits
C,
in general
vitamin
also.
C. You need to get iron from the green leafy vegetables like skuma, and there are many, spinach.
Yes.
Yeah, all these green leafy vegetables. And then you require zinc. Okay, so cereals are also rich in zinc. Okay, and the green leafy vegetables are also rich in zinc. So all these are micronutrients that boost the body's immunity, and they help in the fight of COVID. COVID is a virus. Usually, viruses like common cold, flu, ya kawaida, homa,
Yes.
we fight them off with normal body immunity.
Hii homa ya baridi tu.
Yes, you know, it's just your body immunity that will fight off. You don't, even if you don't go and take any drug, itaisha, ni kukunywa tu maji, you know, some water, and you'll be fine. Just rehydration, yeah, to
And you're
put
good
back.
to go.
But
in that case.
COVID has seemed to be a more stronger virus. It's more aggressive, more intense. It kills faster. I think if not managed, COVID has the capacity to kill you in 30 days. Yeah, if nothing has been done. So it's scary. It's scary. There's no vaccine. There's no cure. It's killed thousands and thousands of people. So we are all concerned. But then how do we manage a COVID patient who has come into theater,
Yes.
either has an emergency or has an urgency?
Okay.
Okay.
The two cases that we talked about earlier.
Exactly. So let's try and relate the two. So in
Yes.
hospital, what are we doing now? So what we are doing in healthcare is that we cannot sentence a patient to death because they have COVID. Okay? As medics, it is our duty to save life, regardless of whether someone has COVID or not. So first, the medics have to protect themselves.
That is
Okay.
the first
The
step.
first thing,
Okay.
protection and safety of the medics, all of them, from the patient's condition. They should not get infected, because if they get infected, then we have to isolate them. So who will come and work on
You
the
can't
others?
get infected just because you're trying to save
Yes.
a patient.
So what we do, we always do a test for every patient who's going to go into theater, so that the whole theater team,
That is a COVID test for any patient who had been scheduled for a theater or set
Yes.
to just go in.
any patient now who is going to theater,
Okay.
regardless of whether he has symptoms or not, a COVID test is a must. Okay? So if you are found to be COVID positive, the procedure has to go on. It is scheduled.
So the theater will still.
The procedure has to
surgery
go
will
on.
still happen.
The only thing that happens is that the team has to prepare in a certain way.
It's now different.
It's about the protection of the medics, that's all. Yeah, and the disinfection of the whole area after the procedure. So immediately after this procedure, of this COVID positive patient, all the doctors have to dress up with PPE, yeah, and then they have to be ready. Immediately after, they have to disinfect everything, yeah, and then wait for some time before they can bring in any other procedure. Okay? So that is the process. When someone is COVID negative, normal process. People don't have to really dress up so much and use PPE, a lot of PPE. So it's normal procedure. Patient is normal, you know. It's normal operation. It's not a COVID patient. So this is what the only difference that has come with the COVID.
So that means if someone has been scheduled for a surgery, they can still be able to go in and don't have to fear that I might get infected. You know, because again, there's also that fear of, I might be negative, I don't have the disease, I'm scheduled for a surgery next week, but there's that fear in me that if I go, what if I get COVID? Because again, there's that whole idea of, when you just hear hospitals, you just think COVID. So I think you've at least well broken it for us and try to make us understand that there's a process for someone who's COVID positive and they're set to go for theater, and someone who's just okay. Now let's talk about this.
And even though, just to come, let me just, even after the procedure. Okay. The COVID positive patients shall be put in a separate ward. Ward. Where no one else is allowed to walk in. Okay? As the other team. So there's a clear demarcation in the ward and theaters on which patient goes what direction, depending on the current situation that is happening of COVID.
Okay, so what also this means is that any patient can go to hospital for a checkup. If they're scheduled for surgery, they can still go through it, and they need to dispel that fear of, what if I get infected? Just from what you've explained. Okay, now very briefly, as you bring it to a close, the aspect of managing stigma. A case in point, someone has gone to hospital, they were scheduled for a procedure, maybe due to complication, they stayed there for like a week or two, they come out and people think, if it's 2 weeks and 3 weeks, this person probably could have had COVID, or they probably got it there. So how do you manage the stigma that comes with this situation and someone who was set or who had gone for a procedure?
Do you mean COVID?
Yes.
You know, we all have to accept that COVID is in the community. Here. And no one has immunity against it. It can get me, it can get anyone. And I think the minister has already said it very clearly every day. And I want to thank him. But as a medic, just like I said, there has to be continuous discussion between the relatives. These relatives who we tend to ignore play a major role in the management of the patient and the community and the people around. You know? If you speak and update them rightly, they'll give a positive feedback to the rest, because there are many other family members who are asking them questions.
Wow, now it makes sense.
Some people in Nyeri, they are calling Nairobi people, you know, how is the patient? If this one in Nairobi says, I don't know, you know, the doctors are not speaking to me. Maybe he's already dead, you know. This kind of communication will cause anxiety. And once there's a certain perception that has been built in the community, it's not easy to remove. But you manage perception by continuous engagement with all the relatives, with all the people surrounding the patient. Yes.
Okay, so at least that, again, it still boils down to family, to relatives.
Exactly.
Wow, and my director just says that he has added us at least 5 more minutes, so we can at least try and exhaust a bit, especially when it comes to that issue of, you know, going for theater and the COVID issue, just trying to relate the two. Again, there's that aspect of diseases, just contracting any kind of diseases again. Someone probably scheduled for, again, the surgery, wants to go to hospital, but then thinks, what if I get other diseases? So what are you medics doing to at least ensure this does not happen, this doesn't take place? Someone just goes in, get their procedure done, after that period of time, they come out and they're good to go.
There is a principle when you speak about quality of care.
Okay.
In hospital, to prevent internal infection. There's a principle we call infection prevention and control of the patient. It does not look good, or it's not a good thing for a patient to walk in with malaria and goes out with pneumonia.
Imagine.
Or develops pneumonia in a hospital.
Or get other many
or
diseases.
Develop cholera, or develop, you know, name it. Or even COVID. So infection prevention and control simply means you want to mitigate a patient from contracting a disease they did not come with, probably from another patient. So part of the things we have to do is things like PPE. Okay? If you are touching this patient
so that's why,
with gloves.
So that's why when you hear health workers continue to say that we need this PPEs, it is this important.
Exactly.
Okay.
Because it will prevent transmission of infection from one patient to another patient. If it is not done, or improper PE is being bought and given to the health workers, they'll get infected themselves. They'll contract the disease from the patient. But above all, if they don't have enough PPE, this health worker has 10 patients to see in the same ward, okay? Probably having different things. He'll transmit this condition to another. But also as health workers, there are practices that we have to do.
Okay.
For example,
Yes.
every after examination of one patient, you're supposed to wash your hands.
It is mandatory.
It is mandatory with water and soap, or with a hand rub of with 70% alcohol. Okay? So that it kills off the germs and you don't transmit the germs to another patient. So this is how it has to be done. Okay? If you're examining someone and you're required to use gloves, you have to use the gloves.
Yes.
Okay?
Yeah.
If you are disposing a material or a tube you have pulled out of a patient, there's a proper way of disposing it off in the right bin, yeah, and the right color-coded bin. So all these are done, are practices that are in the hospital setting to try and minimize infection. But for COVID, if you allow me,
Yes.
because I think we are concluding,
Yeah.
the ministry brought out something we call home-based care. Okay? This is also trying to manage the surging numbers of patients. And I agree with them, because not every patient requires to come to hospital. Because if every patient is going to come to hospital, hospitals will be overwhelmed. Okay? They will be flooded. We shall end up sending all other conditions to manage COVID. Because you'll end up telling all patients with malaria, don't come. And like we have seen, malaria infections have surged in the western region.
Yeah.
So this is not a good thing. So we need to have those that are not severely ill to be managed at home. Okay? And as an organization, we have started a program where we are managing patients with COVID right in their places. Okay?
Right at home.
Right at home, because we send a doctor, we give oxygen, we give all these nutrition drugs that you spoke about. There's a nutritionist on call, there's a doctor on call all the time, so that we try and help the government manage this situation. Because much as we have told the people stay at home, I think we have not done much to reach out to the people. We have had deaths that are happening in houses because people have nowhere to go. Some hospitals are full to capacity. They're not able to get a doctor. So they are in a situation, a confused situation where they don't know what to do. And ever since we launched out, I think we have seen so far about 30 patients. And these are lives that do not require much. Okay? Some are patients with chronic illnesses. They have to be attended to. They have to be given their drugs. COVID itself makes their condition worse. So they require a doctor to go in and really examine them, monitor them, and see how they are faring on a day-to-day basis, so that they go through this phase. Unfortunately, sometimes we have lost some people. But I think up to until when we have a vaccine, that's when this COVID will be out of our country.
Out of our country. Now, Doctor, we have like 1.5 minutes, and I want in this span of time to just tell us your parting shot, especially for that home-based care, for someone who's undergone a procedure. What does it look like, very quickly?
For someone who has undergone a procedure. You know, if someone has undergone a procedure and was COVID, okay, of course you reach, there will be hospital care of about 3-4 days, maximum, yeah, and then you are discharged, but you are still COVID positive. So that is when we come in, and the doctor has to come and monitor you. Remember, COVID, if it finds your body weak, it can make it worse. Yeah. So this person who has undergone a procedure, already their body is having a stress. So they are bound to get a bad COVID situation. But such a patient is a patient who would be kept in hospital slightly longer. Yeah, because their body is already stressed, and with the stress of COVID, they might have a worse infection of COVID. So you want to stay with that patient longer, slightly longer in the hospital for about 7 to 10 days to see.
Before they can go home.
Before you can discharge them onto home-based care if they're symptom-free.
Okay.
Yes.
Now, thank you so much, Dr. for that, at least for giving us insights on what you mean when you say general surgeries, and also just trying to intertwine it with COVID and see how we can move past this, especially for those that are scheduled for procedures or even surgeries of any type.
Thank you so much. Thank you.
Okay, that has been Dr. Bryan Mulando, Head Medics, Bliss Healthcare Limited, talking to us about general surgeries, how to proper manage them, and also just trying to interlink it with COVID and see how we can move past the fear and stigma issue. And that is how we bring it to a close this Tuesday morning. Many thanks for making time. Till tomorrow, stay safe, be kind to one another. My name is Doreen Arange. Good morning.